Simone Spitzer took to Facebook on Tuesday, calling out Alberta Health for labeling her 14-year-old brother's passing a COVID death, despite the fact he was on palliative care for stage 4 brain cancer. In the provincial government's COVID-19 update on Tuesday, Chief Medical Officer Dr. Deena Hinshaw made mention of the boy's death. Although Hinshaw mentioned the boy had complex pre-existing medical conditions that contributed to his death, she included the boy's passing with the reported 33 new COVID deaths over the long weekend. Spitzer confirmed the boy being mentioned was her brother in a Facebook post on Tuesday. He died from stage 4 brain cancer, not from COVID. This is fake news, said Spitzer in the post. He was diagnosed in January 2021 and hospitalized in August. 2 days before his death, he was tested for COVID and it turned out positive. Spitzer goes on to request people share her post and inform others that this story is fake. The Spitzer family was not only devastated by their loss, but they said they were shocked that Nathanael's death was used to add to Alberta Health's COVID-19 numbers as the youngest COVID-19 death to date, and called it fake news in that Tuesday post. Following the provincial update on Tuesday, Alberta NDP leader Rachel Notley and her MLAs attacked Jason Kenney and the Alberta government's handling of the COVID-19 pandemic in the wake of the boy's death. NDP leader Rachel Notley used the opportunity to criticize the UCP and Alberta Health on Twitter for even mentioning that there were pre-existing conditions in Nathanael's death. Telling their loved ones that there were other health complications that contributed to the death offers no comfort whatsoever, tweeted Notley. She also added, no matter what pre-existing conditions they had, this child died during a fourth wave that was preventable. This shouldn't have happened. We need to know what will be done to stop it from happening again. Thomas Dang, the NDP MLA for Edmonton South, followed with another tweet. For the 12% of us in Alberta who have asthma, downplaying the death of a 14-year-old for comorbidities is the opposite of comforting. This is a life snuffed short. It's a tragedy and a disaster. NDP MLA for Edmonton Highlands Norwood, Janice Irwin, also tweeted, I can't stop thinking about this. A family is grieving the loss of their child in a preventable fourth wave. I don't care what other medical conditions this child had. They are gone. We need to all fight for better. This cannot happen again. Irwin also retweeted a post from Dr. Quentin Durand-Moreau of the University of Alberta's Faculty of Medicine. I'm disheartened by this, the tweet says, in reference to Hinshaw's mention of the 14-year-old boy's complex pre-existing condition that played a role in his death. He also tweeted, but I don't understand why we persist in mentioning the pre-existing condition. Is COVID involved? Yes or no? And if yes, it was therefore an avoidable death with better public health policies. Comorbidities do not matter. The Western Standard spoke with Simone Spitzer, the sister of Nathanael, who died of brain cancer last week, and said thank you for trying to get the truth out there with us. Spitzer also shared a link to a GoFundMe page the family set up in loving memory of Nathanael Spitzer. The page mentions Nathanael's fight with brain cancer that led to his untimely death on October 7th. It was created by siblings of Nathanael to assist their parents with the cost of the funeral and the financial toll this has had on them. The donation option has since been disabled as Spitzer told the Western Standard the family has reached their goal for the funeral costs. The Western Standard reached out to Alberta Health for comment on the accusations from the family of Nathanael's death being falsely counted as a COVID death, but has yet to get a response as of publishing.